My name is Kathy Bartos. I'm one of the Sierra Nevada Forum members. We have quite a few in the audience here tonight who are very excited to see all of you here for this scintillating conversation on the Nevada Health Link and the ACA. And our focus tonight will be on questions that have come to us from people who have sent them in ahead of time and those of you that have brought questions with you tonight. And you can either ask for the microphone and our moderator will bring it over to you and you can speak into the microphone. For those of you that are feeling a little shy or would rather just write your question down, we will be circulating with little boxes of index cards and pencils, and you're free to turn your questions in that way. So we hope that if you have any issues or concerns that you've brought with you tonight, that you will all have a chance to be heard. So on that note, I'd like to introduce our moderator for this evening, and our moderator is Dr. Joe McElstrom.
Thanks everyone for coming. Thank you, Kathy. I'll get with you later. I didn't know I was supposed to be doing all that for the FAST team, so I'll try to get on all that. But we're very fortunate tonight to have two experts in the field to help us navigate through this somewhat complex and sometimes very emotional new law, the Affordable Care Act. Tonight we have John Hagar. He served as a naval pilot for 9 years and got his bachelor's in physics with the U.S. Naval Academy in Monterey, California?
In Annapolis, Maryland.
Annapolis, Maryland. And then that was followed up by an MBA at Texas A&M, I believe. He is the Chief Financial Officer for Nevada's Public Employees Benefits Program, responsible for an annual budget of somewhere in the neighborhood of $500 million, serving state and government employees, their dependents, and retirees. And he was appointed our first executive director for the Silver State Health Insurance Exchange, and that was January 2012. Want to take the floor?
Sure. Hello, so welcome. Thanks for coming to learn about Nevada Health Link. So first off, I have to say we are not CMS or healthcare.gov. Okay, that's actually something we've had. That's something that we've had trouble with. Not that we are associated with healthcare.gov, but the problems that they are having are not the problems that we have. We have problems, but not nearly as bad as they do. Most of our major issues, we had issues first half of October. They have been largely resolved. You might run into an error here or there in Nevada Health Link, but for the most part, you can get right through. Actually, I was getting my hair cut on Wednesday, and my barber came up and he says, "Hey, I just went on your website and I got through start to finish in about 20 minutes with the entire application process." Now he's a single person, so it takes a little bit longer for families. But for a single person, start to finish all the way through in 20 minutes, no errors. He liked the plans that he had. You guys can hear me in the back, right? Am I good? Yeah. Okay, good.
Someone asked for a little more help.
Oh, okay. All right. So he went through start to finish in 20 minutes. He selected a plan. He was happy with the plan that he had. And I said, "Hey, well, just out of curiosity, why did you decide to go on now?" And he said, "Well, this weekend I got one of those notices in the mail said my insurance was getting canceled." And so he was pleased with the plan that he had, with the new plan. He said that it was a slightly higher premium, but the deductible was much less. So he was fairly happy with it. And so that kind of brings us into the what happened last week with the president's announcement. And I will say, me personally, how it affected me is that I got about 100 emails in about 2 hours. My email box exploded when that happened. And it was also interesting because the president made his announcement about allowing individuals who have canceled coverage to keep their plans. The next morning, the governor said, we need to consider repealing this, the Affordable Care Act, that we have done the state-based exchange. It's in our best interest to do a state-based exchange, but it's an unworkable law. And I already had an appointment with John Ralston to be on his show on Friday night, so what great timing that was for me to explain how I was supposed to make workable an unworkable law. So anyways, and so the response was, look, the Affordable Care Act is 10 titles, 956 pages. The exchanges are subtitles D, E, and F of Title I of the 10-title law. There are thousands of pages of regulation, so it's a very complicated law. We have a very sharp team working not only at the state level, the staff level, but the vendors that we've got working for us are doing a great job setting up Nevada Health Link. When people report issues, they are fixing them very quickly. We've got a great team of navigators and brokers out there that are trying to make this work. So if anybody can make it work, Nevada can make it work. Despite the fact that we are typically on the bottom end of all the lists, I think in this case we're actually on the top end of the lists. So that's good to hear. Now, I won't say that we are the best state in the country. There are 15 states that are doing state-based exchanges. And just as a reminder, so the option was not to not participate in the Affordable Care Act, to not participate in Obamacare. There's a requirement that we have to participate as a state. The question is whether or not we do it as a state or if we let the feds come in and run it for us. And I think that if you have been watching any of the news, any of the nightly news, we're happy that we're not using healthcare.gov here. The other states, so 15 states, there are a couple states that are doing really well, and so we're all wishing that we could be like them. Kentucky and Connecticut are the ones that we've heard are doing great. There are states that are not doing so well. I won't mention their names because they'll get there. But if you want to, you can figure it out if you do some Google searches. I think we're somewhere in the middle. Our enrollment right now, we've got about 3,000 people that have selected plans. So let's start off the process, right? So actually, we'll just go through here. All right, so you come onto the website. We've had well over 300,000 people that have visited our site, unique visits. Now we've had about 3.8 million web hits at this point, but 300,000+ people have visited our site, and so that's growing on a daily basis. You create an account, and I'm not sure the numbers. The last time I looked, we were at about 60,000, but that was about half a month ago. A number of accounts created. Excuse me. You decide whether or not you want to apply for government assistance, and that could either be Medicaid or CHIP, or it could be a tax credit. And so at this point, we've had, I believe, 50,000+ people that have actually gotten their eligibility determined, that they've been determined for either Medicaid and CHIP. About 20,000 folks have been determined eligible for Medicaid and CHIP. And don't quote me on this, off the top of my head, I think it was about 12,000 people that have been determined eligible for the tax credit, and maybe 9,000 that have been determined eligible for a qualified health plan without the tax credit. So we're getting people through the process. So once they get their eligibility results, so this person is, it says QHP eligible, qualified health plan eligible, or Medicaid eligible. If you're Medicaid eligible, you're not eligible for a tax credit. So more than likely you won't select a commercial plan because it costs a lot more without that tax credit, of course. But some people choose to do that if they can afford it. But this person, Ice T and Madison T, the test names we use in this case, is eligible for Medicaid. And then you go and select your plans, and it looks something like this. There's a little bit of a difference when you go online, but generally this is what you see. So the important part this has all the basic features of a health insurance marketplace, right? You've got your plan design, you've got your benefits, co-pays, deductibles. I know it's hard to read. You've got your premium, the amount of subsidy that you get, and the amount that you pay. Of course, the subsidy is not available in other marketplaces unless they're state-based exchanges or the federal exchange, right? You can only get the subsidy, that tax credit, if you go through NevadaHealthLink.com. Okay. You also have, and I'll get to that a little bit more a little bit later. You also have a provider search and a medication search function. So if you have a chronic condition, like I have asthma, I want to make sure my inhaler's on there. The inhalers are all on there. But and you can search by plan to make sure that your plan, search by drug to make sure that the plans that you're looking at are cover that drug. So that's basically the gist of the Shop and Compare. So we've had 3,000 people that have confirmed their selection. We've had their medical selection. We've had almost 6,000 people that have selected dental plans. And you say, well, wait a minute. 3,000 people have selected medical plans, but an additional 3,000 people have selected dental plans. And the reason for that is we have Medicaid individuals who are selecting dental plans. Now that's a really good news story. These are folks that have very low income, so an individual making less than $16,000 a year, They're making less than $16,000 a year, but they recognize the importance of dental health to their overall medical health, and they're willing to spend money. They're willing to pay to have dental coverage. So Medicaid plans and the kids' CHIP program, Nevada Checkup, they offer dental coverage for children, but they don't offer dental coverage for adults, except for some, I don't remember the exact terms. There's some very limited dental coverage for adults in Medicaid. Generally, you don't have dental coverage if you're in Medicaid as an adult. So these adults who make very little money are willing to spend $20, $30 a month to pay for dental coverage, which is a really good news story. Hopefully that will actually lower the cost of Medicaid to the state in the long run. So all the plans in the market, in the individual and small group market going forward, have 10 essential health benefits. So hospitalization, laboratory services, you can read them up here, prescription drugs, emergency services. So what we've heard in the press recently, and it's not really a mainstream press, it's more editorial type items, but the press is that the premiums in Nevada are going up 179%. And I will say, excuse me for sensitive ears, but that is absolute crap. Okay? I'm sorry, I shouldn't swear here. So 179% is absolutely incorrect. Now, the way they did that study, it was a study from the Manhattan Institute. They took the 5 cheapest plans in 2013, in the entire market in 2013, and they compared them to the 5 cheapest plans in Nevada HealthLink in 2014. Now, Nevada HealthLink is not the entire market. The entire market is this big, and Nevada HealthLink is this big, right? There are some 12 medical carriers in the entire market. We have 4 medical carriers. Now, we've got good selections. If you are in Washoe County, Clark County, and Nye County, we have some of the cheapest plans in the market. If they aren't the cheapest plans, they are within $1 or $2 of the cheapest plans. That's unsubsidized. That's if you don't get the tax credit. If you get the tax credit, we have the cheapest plans in the entire market, in the entire state, depending on what your subsidy is. But generally, the lower your income, the better your plan, and you can't get it better anywhere else but Nevada HealthLink. So we have some really good plans. Now, unsubsidized, we don't necessarily have the best rates in the rural counties. So, and now Nye is not considered rural. In this case, Nye is not considered a rural county. It's combined with Clark County. But Carson City and the four surrounding counties and all the other rural counties, they are not quite the best rates. So if you're going to get unsubsidized rates, please go out and look at the entire market. You might be able to find better rates out there outside of Nevada HealthLink. But Nevada HealthLink is a good place to start to understand what benefits are available. Okay? They all cover these essential health benefits. So this study, this Manhattan Institute study, said, all right, I'm going to look at these, let's say 100 plans in the market. There's more than that, but let's just say there's 100 plans. And let's say they start at $50 and go up to, let's say for a child, they go from $50 up to $150. All right? 50, 51, 52, 53, up to $149, $150, right? 100 plans in the market. Okay? And let's say that the new market goes up by 10%. Overall, it goes up by 10%. But we're only going to take a small piece of that. We're only going to take Nevada HealthLink. And let's say we've got 10 plans in the market. So our plans go from 50, 60, 70, 80, 90, 100, up 140, 150, right? It's a good representative of both markets, right? I got 1/10 of the plans. The rates go up by $10, right? Does that make sense so far? We're all right here, following the math? All right, so if I compare the 5, now there's other plans at 51, 52, 53, 54, 55, up to 150, right, that aren't included in the study that the Manhattan Institute did, right? So they compared plans at 50, 51, 52, 53, $54 today to plans at 50, 60, 70, 80, $90. So you can already see how taking a small subset doesn't make sense, yeah? Right, so they were already comparing apples and oranges. Then what they did is they said, all right, let's look at these plans. They said, all right, those are the cheapest plans in the market, so it's going up 179%. But if you look at the plans, some of the plans that they're comparing in the new market are silver plans at a $2,000 deductible. Now, some of them have a $5,000 deductible. Some of them have $2,000 deductible. But they were all compared to plans that had $10,000 deductibles. $10,000 deductibles, $15,000 out-of-pocket maximums. And they said, oh, well, these plans that had $2,000 deductibles, their premiums went up by 179%. Well, that doesn't make any sense. You're not comparing the same things together. You're taking a plan that has $15,000 out-of-pocket maximums. Oh, and by the way, it didn't cover prescription drug coverage, which is an essential health benefit now, and it didn't cover doctor visits, but the cost went up by 179%. So you can see there were some holes in these plans that they were comparing them to. Now, it is true that some plans are going up in cost. It is true that with more benefits that are covered, the cost will be a little bit higher, at least initially until the market settles out. But if you're really looking at, okay, well, on this plan today, with a $15,000 out-of-pocket maximum, I can't get any of my drugs covered, right? I can't get any of my doctor visits covered. You're not really looking at the whole picture. So when you look at the reports in the newspaper, what I would say is only believe about 1/4 of what you see in the paper, especially if they quote me. Sir?
Would you rather see questions at the end of your talk, or can I raise?
Oh, go for it.
Okay, let's say I go on the Nevada Health site and I compare what rates are there with what I'm paying now. And first I have to say, I'm in an unsubsidized category. I'm not going to be eligible for assistance, okay? The premiums that I see on the site are way, way, way higher.
Absolutely. Okay,
than what I'm paying now. And for instance, I was looking, and I did it two ways, because my wife and 2 children are on one plan, because I'm diabetic and I don't have, and up until now, at least, or until the end of this year, and that's another question, I couldn't get insurance, period. So I was on the federal PCIP plan at $400 a month. I'm looking at a minimum for me alone, the minimum on the site is $655 a month, which is, you do the math, it's more than a 50% increase.
Sure.
If I look to cover myself and my family, I was looking at more than double. It was crazy.
Right, so you were on the PSIP program?
I am now, until
Right.
December 31st.
Okay, so the PSIP program is a very highly subsidized program. It's like being on employer coverage, and the employer covers 90% of your coverage. Now, I don't know what the percentages are,
Right.
okay, but that's part of what you need to take into account on the PSIP side. Now, if you could get coverage with diabetes, so let's say, assume you could get coverage, my guess is the premium would be even higher than that.
Yeah, so the question is, when does the open market have to offer me coverage?
Starting on January. So the open enrollment is going on now for all the plans effective January 1st. Okay? And as I said, in the Carson City area, that doesn't include Washoe County, but if you live in Carson City, if you don't live in Washoe County, everybody up here I assume is Northern Nevada. So if you don't live in Washoe County, then unsubsidized, if you can't be eligible for the tax credit, then you are most likely going to be better off enrolling in coverage outside of Nevada HealthLink. However, if your income is right at about 400% FPL, so let's say you are an individual, and I think the income level is about $46,000 a year. So let's say you make $47,000 a year. Right? You look at Nevada HealthLink, you're back, I can't get subsidized, they cost more money. I'm not going to go there. If you don't go there, you cannot get a tax credit. But let's say at the end of the year, let's say halfway through the year, you get a reduction in wages. Right? You get a 10% reduction in your pay. Right? 10% of 40,000 is 2,000 is 4,000, but you're only going to get the reduction for half the year, so $2,000. So you went from 47,000 to 45,000. Now suddenly you're eligible for the tax credit. Because the rates are higher, that tax credit can be pretty big. For somebody in their 50s and 60s, you're talking a potential $12,000 a year. So you need to weigh that risk in that risk of not getting a tax credit and going outside of Nevada HealthLink. So keep that in mind. And so what I was going toward was that discussion about the person that got the cancellation notice. Okay, I don't know what the state's going to do as far as cancellation notices. Whether the state can even allow those that have their insurance canceled because they don't comply with the Affordable Care Act, whether or not they can continue those plans, and the state is trying to evaluate that. But regardless of what they do, you should take that plan that's being canceled, or whatever plan you might be on. This is a great time to kind of look at your plan and determine what coverage do I actually have. You might find that plan is being canceled because it doesn't cover prescription drug benefits, and maybe you need that prescription drug benefit. For most people, you usually don't get that coverage if you're younger. If you're older, you typically you know you need the drug, so you probably have that prescription drug coverage. But there might be some hole in this coverage that you don't know about. There might be some conditions that are excluded that you're not aware of. Take a good hard look at that policy today. Compare it to the policies that are on Nevada Health Link. That will give you an idea of what's in the market. The policies are generally the same, and there's some tweaks and stuff, but for the most part, they all cover. Inside Nevada Health Link and outside Nevada Health Link, they all cover all 10 essential health benefits. Okay, they're all modeled after what was the HPN point of service plan in the first quarter of 2012. Okay, so they all have this basic set of benefits. Check to see if your policy is going to be extended, make sure it doesn't have any holes in it. Okay? If you have employer-based coverage, it's probably the best you're going to get because typically the employer subsidizes quite a bit of it. But check it out and see if there's some coverage in there that you're missing that you think that you need. And start with Nevada Health Link. You don't have to finish there. Again, if you find a benefit that's better out somewhere else, then by all means go there. You can see all the rates in the entire market at doi.nv.gov. Okay, doi.nv.gov. It says 2014 health insurance rates or 2014 Health Care Act or something like that. There'll be a button to check the rates. You select individual, you select the county that you live in, your age. You can see all the rates in the market inside and outside the exchange. Okay, but I recommend starting at Nevada Health Link because you'll get the richest texture of information from Nevada Health Link. Yes?
Can you repeat that, please?
doi.nv.gov. So DOI is in Division of Insurance. .nv is in Nevada.gov.
Thank you, John.
Yes, sir.
John, anytime you refer to tax credits, it's related to income level.
It's related to income, absolutely.
Okay.
So let's talk about that. All right. So you can go on to Nevada Health Link and enroll in a qualified health plan without the tax credit. You can enroll in a medical plan without the tax credit. The minimum requirement is that you have to be a legal resident, right? You can't be in the United States illegally, and you have to be a resident of Nevada. And then you can't be incarcerated. And since you're in this room, I would imagine you're not incarcerated, so that's a good step. If you are incarcerated, your medical is typically paid for, so you don't have to worry about it.
There's the answer.
To be eligible for a tax credit, you have to file taxes in 2014. Don't have to worry about 2012 and 2013. Now, if you file taxes in 2012, it makes it easier because we bounce your information off the Federal Data Services Hub. Now a little disclaimer there. All right, so about 2 weeks ago, there was an article in the paper, I think it was the Nevada Journal, that said that Nevada's data is at risk. It connects to the federal program, right? There was a paper that was released that said that the information in healthcare.gov was at risk. There's two different systems. There's the Federal Data Services Hub that we connect to and healthcare.gov, and we have nothing to do with healthcare.gov. Everything that we've seen with the Federal Data Services Hub is secure, plenty of testing, everything was done on time, and so Nevada's data is not at risk. But the papers like to put 2 and 2 together, 2 and 2 plus 5, 2 and 2 equals 5 in the paper, and so they put that together. It didn't make any sense, and so we had to rebut that and make sure everybody knows our data in Nevada is secure. But it goes into what's called the Federal Data Services Hub. It requests information from the Federal Data Services Hub. So you put in your information. You attest to your income. This is what you think your income is going to be in 2014. We send your name and social security number to the IRS and say what was their latest tax filing income. They send that back to us, and we say, yeah, close enough, or no, not close enough. We need you to provide proof. Okay. Now, the hub, while we have to send information to get information, there is no information collection at the hub. At least that's what they tell us. The hub is not in Utah where they have the NSA. It's separate. All right. And the information, if we're sending the IRS your name and social security number, they've already got that, right? You file taxes every year, right? Now, some of the issue is, well, my income in 2012 is not what my income is going to be in 2014. So it's a little bit different. Why are you checking that? Well, we got to check that it's close. But again, if it's not accurate, we'll ask you to just provide proof, a pay stub, something like that. Yes, ma'am.
Is it adjusted gross income on your tax return?
Even better, it's modified adjusted gross income. So you take your gross income, you adjust it, and then you modify it just to make it confusing. And what I didn't realize until about 2 months ago is adjusted gross income is very specific, right? You do your tax form, you start with your gross, you do some deductions, you get to your adjusted gross income. That's easy, that's the same for everybody. Modified and adjusted gross income is defined differently in every law that's out there. Not only is it defined different, because when we started this process, we said, oh yeah, here I Googled it, right? Modified adjusted gross income, here's your adjusted gross income modified by these factors. And we started telling people that, and then we realized it was wrong. Because the Affordable Care Act says, modified adjusted gross income for the purposes of your advanced premium tax credit is your adjusted gross income with your Social Security benefits and your interest expense added back in. I think, something like that.
Yeah.
Which, by the way, is different from the modified adjusted gross income to determine your tax penalty. So the same law, two different definitions of modified adjusted gross income. I didn't make this stuff up, honestly. They tried to make it more complicated, but they couldn't figure out how. You had a question, sir?
But so for simple people like us that, or like those of us, I'll just say, those of us that don't get Social Security benefits right now, it's our adjusted gross income on our 1040 form.
Plus your interest, plus your bank account interest.
Interest income.
Interest income, there you go. That's the term. Ding, ding, ding.
Plus
interest income.
added back in.
Yeah, plus, yeah. So for most of us, interest income, I get a statement, it's like a $15. Woohoo! Right?
I'm sorry.
So
On top, your interest is already in your adjusted gross income.
it's reversed back out for your modified adjusted gross income. So let me put it this way. The system will answer the question for you. We'll ask the question. So the system will ask, what's your gross income? What are the deductions you have? Are there any other sources of income? All right. If you're off by $15, don't worry about it. Okay? Here's the key. It will all be reconciled at the end. Right? The IRS will always get you at the end, right? So this is a tax. All right? It's a tax credit. Okay? Now let's go back to, you put yourself in 2009. All right? I'm in 2009, probably 2008. I don't know, whatever the committees were starting to talk about the Affordable Care Act. At that time, there were 3 bills going forward, right? There were 3 bills going forward. One of them was 2,500 pages. How many did I say this yet? How many pages in the Patient Protection and Affordable Care Act?
1,000.
900 pages. 906 pages. And then 50 pages in the Healthcare Education and Reconciliation Act, signed 1 week later, right? So that is the Affordable Care Act, or these 2 bills, 956 pages, tens of thousands of pages of regulations. And, boy, I lost where I was going with that. So put yourself back in 2009. You're trying to work your way through this. You think, all right, how am I going to get this bill passed? You know, from one perspective, there are those that want universal health care, and we know that's the far left, and there are those on the far right that say don't touch anything, right? And there's a majority in the middle that say, hey, something has to be done. We don't know what. Yeah, close enough, right? All right, okay. So I might step on some toes. And please, this is a little bit glib, but just go with me here. All right, you're trying to get this law passed. How am I going to get this law passed? Well, there's this thing, and so I'm the Democratic majority, or I'm the Democratic president at the time, right? And so, okay, how do I get this thing going? Well, hey, there's this new thing that Mitt Romney signed in Massachusetts called the Healthcare Exchange, right? The Heritage Foundation come up with these exchanges. It's a conservative idea. We can try and get people enrolled in health coverage through these exchanges, right? And on top of that, we can offer a tax credit, right? The right likes tax credits, right? So this should reduce revenue, right? Tax credit reduces revenue. Right now, again, I'm being a little bit glib here, but tax credits reduce revenue. The right side likes tax credits. Let's try to implement this as a tax credit. Well, but then you say, okay, if the insurance premium for a family of 4 is $1,000 a month, which is entirely realistic, especially in Carson City, and this family can only afford $200 a month. Let's say that tax credit is going to be $9,000 a year. They can't pay $1,000 a month right now and wait for a $9,000 tax credit at the end of the year. They can't afford the insurance now, so how are they going to pay for it? Let's create what's called an advanced premium tax credit. Okay? So the advanced premium tax credit is administered by each of the state-based exchanges in the federal exchange. So we're going to ask you, the consumer, when you come on to NevadaHealthLink.com, we're going to ask a bunch of questions. And so you provide the answers as honestly as you possibly can, and put it in the system. And we're going to say, all right, based on what you've provided us, this is what your tax credit is estimated to be per month. Okay? So let's go with, all right, so again, you have to file taxes. If you're married, you have to file jointly. You have to be enrolled in a qualified health plan through the exchange, through Nevada Health Link, and your income has to be below 400% FPL. So, for an individual, your income has to be $46,000 or less, $62,000 for two, $94,200 for a family of four. Okay? If your income is below these thresholds, you should get a tax credit. In Carson City, pretty much you will get a tax credit. The only way you won't is if the market rate is lower than the maximum that you're supposed to pay, but that won't happen too often in Carson City. So, let's pretend that you're a family of four making $47,000 a year. Again, you will not have to figure this out when you're doing this. We will figure it out for you. But just to give you an idea of what cost you would pay if you were subsidized. So you're a family of four making $47,000 a year. You are at twice the federal poverty level. All right, so everybody think in their minds, okay, where am I on this chart? Okay, find your family size, go till you get to your income and go up. You might have to interpolate a little bit. All right, but you can see where you are on the FPL level, right? Okay, next step, you find out, so this family of four making 200% FPL will pay no more than $250 a month for the second cheapest silver plan. Okay, so if you remember, where were you at the FPL level? So find your family size and the FPL level and go to get to the where it crosses, and that would be the most you would pay for the second lowest silver plan. Okay, anything on top of that would be a subsidy. All right. Now, again, we will calculate all that for you. But let's say that you're that family of four making $47,000 a year. Let's pretend the premium's $1,000, and you're going to pay $250 a month. Right? You're going to pay this amount right here. Okay? Your subsidy will be $750 a month. Now, you say $1,000 a month, that's $12,000 per year. So $12,000 for an insurance plan. That's actually a pretty good rate. And if you have been on employer-sponsored health insurance all your life, you're about having a heart attack and you'll have to use your health insurance. But for those that have had to purchase insurance in the individual market, that's actually fairly reasonable, $1,000 for a family of four. Probably even cheaper here. It's probably more expensive here, so $1,000 is probably pretty cheap. So $1,000 a month, $250. If you have to pay $250 a month, you're only going to pay $3,000. You're going to get a $9,000 tax credit for this $12,000 product. Now, women, if you go to Macy's or Dillard's, you go to the 75% off rack. You get this is a great deal, right? You come home with those, that nice pair of shoes that you got at 75% off. You get, look, honey, look what a great deal I got. I got this I saved you 75%, and we're all thinking you cost me 25%. But those sure do look good, right? But you're taking a $12,000 product, you're getting 75% off. That's a pretty good deal. $9,000 tax credit. The flip side of that, though, is that male perspective is, I got to pay $3,000 for this product. So the concern that we have is, of course, can we get people to enroll in coverage at $3,000 when they're making $47,000 a year? They're spending $47,000 a year on life, and now we're asking them to spend $3,000 on an insurance product. All right, that's a big deal. Now, for a lot of people that have been trying to get health insurance all their lives, this is a good deal. Maybe they could do it if it were just a little bit less than what it is now. Maybe they could do it if there were no pre-existing condition exclusions. Starting in 2014, there are no pre-existing condition exclusions. They cannot turn you away. When you enroll in Nevada Health Link, that is the rate that you will pay. Whatever it is that we calculate, it will not change. So today, you go on to eHealth. Anybody try to go on eHealth before? Oh, I have, because I'm looking at my competition. So on eHealth, it'll say, all right, enter your zip code, enter your age, and it'll say start date, December 1st. And it'll show this rate of $60 a month. You're like, oh, that's pretty good. You put a start date January 1st, 2014, and the great marketing ploy, it goes up to $150, right? Then you go in, it's okay, January 1st, I'm going to look at my plans, and you go through there. Now, if you didn't go to January 1st, if you just stayed in December, what typically happens, okay, it's only $60, $70. You go in, you say, all right, this is my age, it goes up a little bit. You say, oh, I'm a woman, it goes up a little bit more. You say, oh, I've got this pre-existing condition, it goes up a little bit more. or you accidentally tell them about something that you've got, and they say, oh, sorry, we can't offer you health insurance. You put that rate in, it goes up. In fact, you apply for coverage based on the rate that they show you. That rate is for the perfectly healthy person. When you actually apply, they send that application to the insurance company, and they decide what the rate will actually end up being and whether or not they want to cover you. Starting in 2014, they don't do that anymore. The rate that they offer, whether it's Nevada HealthLink or elsewhere, the rate that they offer is the rate that it will be. They cannot turn you away. They cannot rate you up. As it is rated only on your age, your whether or not you use tobacco, where you live, and number of dependents. But you can smoke weed and it's okay.
So come that time, they can't go up, they can't deny you, but those premiums can raise, right? After
The premiums go up once a year.
say June or
So the premium, so the plan year for individual plans always ends December 31st going forward. So plans are January through December. And there will always be an open enrollment. So this year, open enrollment goes from October 1st of this year till March 31st of 2014. So 6 months, initial open enrollment. In the future, because we didn't have enough to do between October 15th and December 7th, it will line up with the Medicare enrollment. In the future, October 15th through December 7th, that's when you'll be able to choose a new plan if you want to, or keep your current plan for an effective date of January 1st. Now, you've got medical inflation, so the carriers will continually increase costs, just like they have in the past. The hope is that with this increased competition, that the cost won't go up as much. We'll see whether that's true or not. I don't know. Yes, sir?
I just want to make sure I understand how this is really going to work in the real world. Okay, the rates up there on the board, those are subsidized rates.
Yes.
But so, when I buy insurance, will I have to pay the unsubsidized rates and then get rebated by a tax credit April 15th? Is that how it works?
No. So what happens is, let's say that you choose this particular plan. Now you can choose a more expensive plan and buy more, or a cheaper plan and pay less. But the subsidy for this theoretical family of four is going to be $750 a month, so $9,000 for the year, right? So let's say that they chose the second lowest silver plan at $250 a month. They said, that's the plan for me, for my family. Nevada HealthLink will send them a bill, $250 a month. That family will pay Nevada HealthLink, and then we will send that money to the insurance carrier. The insurance carrier will get the remaining $750 directly from the feds. Okay? Now, at the end of the year, let's say your income changes. Let's say that family of four, they got a raise. Instead of $47,000 a year, they made $48,000 a year. Or maybe they didn't quite estimate it right now, because this is a guess for 2014. Let's say it ended up being $48,000 a year. So they should have had a slightly smaller tax credit. That will be adjusted in their taxes, and they may owe $100 back or $200 back, right? Now, here's something to keep in mind. If your income goes up, the tax credit would go down, which would create a tax liability at the end of the year. The other side of that is if your income goes down, the tax credit goes up. And you can only get that tax credit if you enroll in a qualified health plan through Nevada HealthLink. So, here's some places where you have to be aware of. Let's say that you are a married couple, just two people. Let's go back here. Let's say you make $62,000 a year. And since you live in Elko, your plan, and let's say you're a married couple in your 50s, because the second lowest silver plan is, let's actually, since the second lowest silver plan is for a married couple in their 50s, late 50s, early 60s, let's say it's $1,300, okay, which is pretty common today. If you don't have a premium that is that high, it's because you've got a deductible that's outrageous. But let's say it's $1,300, so basically $1,000 a month. All right, so let's say this married couple has a tax credit of $1,000 a month, $12,000 for the year. Okay, so they are at $62,000 a year, and let's pretend that they guessed their income absolutely perfect. $62,000 on the nose. They get a $1,000 tax credit. They get into December, and their ever so generous boss gives them a $500 Christmas bonus. Oh, exactly. They went from $62,000 to $62,500. They are now above the tax eligibility threshold. and they would owe that $12,000 back to the IRS.
Oh my God.
Yes, exactly. So, a couple things. So first of all, I know that I'm going to get crucified next winter and spring when people start doing their taxes. Fortunately, not by that many people. Mostly just in the rural areas, which is a very small percentage of the population, and mostly just for older individuals. Unfortunately, most of you in this room will be close to that, but it's only for those that are close to the 400% FPL. Okay? So it should be very few people. That's why I'm trying to get the word out now. Be very careful about what you do. We've got a couple ways to mitigate that. So if, let's say that we calculate your tax credits $1,000 and you say, you know, I really like this and I want to do it, but I don't want to have a big tax liability. I can take a smaller amount out of my premium. So instead of paying $1,300 or paying the $300 a month that you saw, I can choose to pay more now and then potentially have a bigger tax break later on. Or if my income goes up, when I didn't realize it was going to go up, then I could potentially have a smaller tax liability later. Or you say, hey boss, why don't you just keep the $500? Thanks for the gift. I appreciate the sentiment.
On the income side, if you have dependent children, but they work, does their income count to the level?
It's family income. So if you claim it on your taxes, it counts.
But I don't claim it on my taxes. And let's
Do you-
say
Then
they're
they're not
under,
dependent.
they don't have to file, but they get a W-2
If you claim it on your taxes, it's included.
on my tax.
Yep.
Yeah.
But what if they file individually?
If they file individually, they are eligible to enroll separately. And eligible for Medicaid?
Yeah.
Usually. I mean, right? Your kid making $1,000 a month if he's lucky. He'd be under $16,000 a year, so he'd be eligible for Medicaid. Is that?
Yep.
Yeah.
That's true.
That's why I got that's why I got these guys here, because they keep me honest.
That's my situation exactly. What if they only made $2,000? They don't really have to file, and you're still claiming them as a dependent.
So that's a tax.
If they're claimed as a dependent,
Sorry?
Yes.
if they're claimed as a dependent,
They're my dependent, but they have income, and it's not on my taxes with them.
so the tax credit is based on your tax filing.
Okay.
And contact your local tax professional. Yes.
So if it's a family of three, and let's say mother and daughter have hometown health or something, the employer. But let's say the spouse's employer says, I'm not doing insurance anymore for you guys. So we would still look at the household income?
Yeah. All right. So let's take that same family of four. Okay. That same family of four making $47,000 a year, right there at 200%. Let's take them back over to here. So you've got three people. Let's say husband and two kids are covered under the husband's insurance as the husband's employer, but the wife is not. Okay. And let's pretend the premium for the wife is $300 a month. Okay. That they will. Their tax credit will be the difference between the $300 and the $250. So they're going to pay no more than $250 for one person or the entire family. They would get a tax credit that's adjusted based on they would pay no more than $250 a month. So this family, this imaginary family would get a $50 tax credit instead of a $750 tax credit because they're covered under the employer. Now, there's all sorts of other weird twists that happen when you've got people covered by other parts of the insurance, but basically it lowers the tax credit. That family will not pay more than $250 for the uninsured people, the people that get insurance just in Nevada Health Link. Make sense? Again, we will just answer the questions in the system, we'll figure it out for you. And so go through the process, determine whether or not you say, you know what, this is my tax credit, this isn't worth it, or it is worth it, whatever. If you get a tax credit, if the system says you get a tax credit, it is worth it unless you expect to have a raise in 2014, which might make you ineligible. You want to figure that into your income that's provided. Yes, it makes it complicated. We are trying to make it as simple as possible. It has been an interesting couple years making it as simple as we possibly could. All right. I think I'll stop. I think that's a good start to the questions. I'm sure you have lots. could pick the brains dribbling up out of her ears and start to stick them in, because this has been quite a challenge over the last 2 years trying to make heads or tails of this stuff. Thank you.
Well done. Great questions, by the way. Next up is Miss Evans. Miss Evans, Tracy Evans, came to us by way of San Francisco back in 1985, settling in Reno, Nevada. She worked in personnel management for some years before having quite a long career, spending more than a decade with St. Mary's, working in healthcare, member services, and human resources. Now, over the course of the last 9 years, she's worked in employee benefits management for a local grocery store chain, and the summer of this year, she began her employment with the Community Health Alliance, providing outreach as an Affordable Care Act educator. And that's what she'll be presenting on tonight. I think what we'll do a little bit differently here, I want her, she has several things to get through, and I'd like her to do that first, and then we'll hold questions at the end, which then can be broadcast to both parties. If that would work. Ms. Evans, thank you.
Thank you. Thank you, guys. So John, of course, is the expert. He's been doing this for 2 years, and of course he has much more financial knowledge than I do. So want to summarize some of the things he talked about, some of our experiences as navigators, and I also have 2 of our sisters with us tonight, so in case there are questions afterwards, they can give you some real life experience. So in the front row, Sonia Alegria and Marielle Fong, they're both bilingual. So they're sisters. I'm a navigator. Just to let you know, we begin every presentation with showing you our badges. These are kind of important to us, and especially to me, because I did health insurance for almost 20 years. I gave up my life and health insurance license to get this license. I had to give it up because you need to know that navigators, enrollment assisters, and certified application counselors were not biased. So when you go to a broker or agent, that's great, and you can go to them, and they're licensed through the exchange as well. They can give you advice as to which plan to choose. We have sworn to John and to the exchange. We are not going to tell you which insurance company is better, which plan is better. We're going to educate you, and especially these ladies and myself, we're going to tell you what options you have. But if you need somebody to tell you which plan do I pick, then you'll want to go to a broker or an agent. And they play a vital role in this whole process. Our main objective is to educate you and to help you to select the plan that's best for you without being biased, okay? So this badge is really important to me. It has my picture, it has my license number, it has the state seal of Nevada, and says Nevada Health Link. I think it's really important too because in the Reno-Sparks area, we're aware of some fraud going on. So you need to make sure that you're talking to somebody and giving your private information to them based on seeing this license. Some people are charging up to $80 for enrollment assistance. You need to know there is no charge for our assistance. So if you get to Nevada Health Link and you get halfway through the application, you get stuck, you need help, you don't want to go through it yourself, you don't have internet access, that's what enrollment assisters, CACs, and navigators are for. We're there to assist you free of charge. Same thing with agents and brokers. They should not be charging you for their assistance. So that's an important piece to what we do. I think it's important for you to know that you don't need to be alone out there. There's help. Things we left on the back table, and then I want to go through some of the things maybe that John didn't cover and kind of reiterate some things we've experienced. So there's a little handy pocket guide for you. We always give these out when we're going to presentations because it has open enrollment dates on it for you. It also has NevadaHealthLink.com, the website address, and the call center number. So this is an important piece that you might want to take with you. There's also a little card. These are all Nevada Health Link materials. If you think of a question and you need to get the answer to it, you can also grab one of our brochures, but this is the little card you might want to ask your question on. This has become a really handy tool for us. This is also Nevada Health Link. It's similar to that little pocket guide. But what we do is when we're enrolling people, we hand them one of these sheets, and they're in English and Spanish, as most of the materials from Nevada HealthLink are. So on the bottom, it again has the call center number, as well as NevadaHealthLink.com. And what we do is we put member ID numbers on this, usernames and passwords. There's also magnets in the back. Take this to your refrigerator, because as John pointed out in the end, when my financial situation changes during the year and I need to get back into Nevada HealthLink, if I lose a job, gain a job, get married, divorced, adoption, have kids move away, I need to get back in here and maybe adjust what I've enrolled in or adjust my tax credit, right? This is an important piece. Going back to how we get funded. And that was in the news not too long ago as well when they were trying to defund, right? You guys all heard about that? So we would go out and do our presentations and people would say, what about if the Affordable Care Act isn't going to go through? What if they defund it in Congress? So our money, John's money, it's all in the bank. Okay? Our money is paid for. We're funded actually as a sub-grantee of Great Basin Primary Care Association. That was a grant that the Silver State Health Insurance gave to Great Basin. Great Basin then in turn gave a sub-grant to Community Health Alliance. And Community Health Alliance, this brochure is in the back. This is the locations where you can get enrollment assisters through our assisters or the certified application counselors. The number on the bottom is the number you can call for your one-on-one appointment. And again, it's in Spanish on the back. Every Tuesday night, at the Hawk Clinic at 1055 South Wells. So tonight, as we speak, we're doing a presentation in English and a presentation in Spanish every Tuesday until March 25th. So we have one room in Spanish and one room in English. So if you need to come see another presentation, please join us on Tuesdays. As we say when we're doing that presentation, we're here every week. Come by and see us. Okay. Then, further, by doing the presentations that we've done, similar to John's presentation, we've kind of put up the PowerPoint on just 6 pages back to back. Because your grant funding didn't pay for this, HRSA did, but that's okay. So what we did is we took the most finite points of what most people were asking and the questions you have. So instead of taking notes on John's presentation, most of the information is in this packet. It's a handout that you get to take with you. So if you want to see the income chart with the family of 4 and what that is, you can actually take it home. It's in the back. We saved the best for last, kind of like John did. But here's that health insurance chart, family of 4. And then remember, I think it's important to note, as John told you, if I'm that family of 4, making $47,100 a year, and my premium is $247 or $250 with the subsidy, remember that's on the second lowest cost silver plan. We didn't really go through what those metal plans mean. There's an actuarial value. So what I'd like to refer to is in this packet, do all of you have this packet? Would you like a minute to go back and get one? The Reno Hawk Clinic or Sun Valley Redfield Center or Neal Road Redfield Center. We're also in Virginia City, so we have 5 locations. Oh, here we go. So in your handout, you have the metal tiers. You don't have as extensive of a slide as John has given you here. But the AV is for actuarial value. So I'll go off the presentation rather than what John's showing you here. But if we're at the metal tiers, mine's a little more simplistic, and we're on page, yikes. We're on page 8. So it's plan categories. If you've heard about these metal tiers, what it goes is platinum level is the premium type plan. So platinum level down to gold, down to silver and bronze, and finally at the lowest category, there's what they call the catastrophic. So let's talk about the catastrophic first. That's for the young invincibles. Those are the kids that are maybe 18 to 30, and I call them kids because I just turned 60. So they're kids to me. And I have a 22-year-old. So if they're anywhere between 18 and 30, and they go on to Nevada HealthLink, they can enroll in what's called a catastrophic plan, those young invincibles. The catastrophic plan is for those young invincibles that want to have insurance coverage and they want the absolute lowest premium. They're still going to have all the essential health benefits that are covered in their plan. And you have the essential health benefits again on page 9. So you have a list of those. In any case, on that catastrophic coverage, they're going to pay full premium. That premium is not eligible for advanced premium tax credit or any tax subsidies. So those young invincibles are going to see that catastrophic plan. They're probably going to have the most out-of-pocket limit that they can have. So we didn't talk about what's the maximum out-of-pocket limit for all the plans, and this is IRS regulated throughout the country. So that maximum amount for 2014 for a single person is $6,350. 2 times for a family, which is $12,700. That's my maximum out-of-pocket on any of the plans. You can look for a lower maximum out-of-pocket, but you'll find that probably in your platinum level. So up to the bronze level, that's my lowest premium plan, the least expensive plan, and the actuarial value, as you see in John's slide, is that 60% of my out-of-pocket costs are going to be covered by the insurance company, 40% is covered by me. So if I have a $100 bill, a $100 bill for my doctor visit, 60% is going to be covered by the insurance company, $40 copayment usually for me. That's a bronze plan.
On average.
On average, yes. And you'll see the differences as you go shopping. If I'm in the silver plan, that actuarial value is 70% from the insurance company, 30% is mainly what I'm going to pay in my out-of-pocket costs. The premium's slightly higher than the bronze plan. If I'm in the gold plan, again, I'm slightly higher than the silver plan for my monthly premium, and my out-of-pocket costs are going to be about 20%, and the insurance company is going to cover about 80% of those costs. And the platinum plan, the highest metal tier, is going to be 90% covered by the insurance company approximately, and 10% out of my pocket expenses. Now that premium should be the most expensive, but that's not always the case. So as I and my team, we went through this the beginning of October, as I'm sure John and a lot of his team, when you're first going out there and you're looking at the plans, I did myself at a $30,000 income, looked at the platinum plan that I could find. I got a nice little subsidy. I have a $10 copayment on that platinum plan and only $3,500 out of my pocket instead of the $6,350. So you need to look at what's the best bang for your buck. It's just like going shopping. I don't think we talked about the shop and compare as much as I think that's a great feature. So when you're looking through the plans after you've put in your application, you get to check on the box and you get to compare up to 3 plans at a time. It's just like shopping on Amazon or any online shopping. So you see your premium at the top, you see your deductibles, your out-of-pocket costs. John's helping me here. This is nice to have the executive director helping me. This is nice, you guys. So you get to shop and compare. So when you're looking at this, you can check this box here, go down a little bit and say, what other plans do I want to see? And when I shop and compare, it's going to look side by side, just like I'm shopping for that new car. What are the options I have? What's my out-of-pocket? What's my copayment? But before I do that, and I think you all should do this before, and this is from my insurance background, is I first of all want to make sure I've done this provider search, because I don't want to look at a plan that doesn't have my primary care. You guys might feel differently. I've had my primary care 20 years. So my first thing is to do my provider search and my prescription search. Does it have my hospital covered in my provider search? Do I have my cardiologist if I need one? Do I have my dermatologist? Which doctors are important to me? Because it's going to show me when I do that search, which plans are those doctors in. And as we enroll people, that's an important thing to know. And as the sisters and navigators and the CACs, we first of all want to make sure that you're not going to be disappointed when you get your plan and you find out, oh, Dr. Uvalde isn't covered. That's kind of scary. I'm locked in for a year. Remember, you make this choice. Unless you have a family status change, you're locked in for the whole year. It's just like your group insurance. So, there aren't many other things that John didn't talk about. They're all here for you, the essential health benefits. I think the one that I was a little confused about is I knew that we had 11 essential health benefits instead of 10. And the one I saw that was left out, that maybe it was left out for a reason because I had a presentation where somebody got a little irate with me. There is pediatric, dental, and vision are covered for those children 19 and younger. That's an option that has to be chosen if you're buying medical for your dependent children. So if that was left off, there it is. So I don't know which one is different, but I have 11.
So there are 10, but oftentimes they split up pediatric dental and pediatric vision.
Okay.
So that it was actually listed in the Affordable Care Act as one. It's pediatric services including dental and vision care, and a lot of times that ends up getting split off on the list as two.
So
I wasn't trying to hide anything.
So the gentleman that talked to me in one presentation, it's, you know, you say that essential health benefits have to be included on each plan. It's a little semantics. So when I'm in there and I'm choosing a plan for my 19-year-old dependent or younger, I won't be able to exit until I've chosen a pediatric dental and vision plan because it's an essential health benefit. So it means I have to buy 2, maybe 3 plans. So that's semantics.
So every medical plan includes the vision coverage, but they don't. None of Nevada's plans include the dental coverage. So you'll go through the medical plan selection, and then you'll go through the dental plan selection. For children under the age of 19, dental coverage is a required purchase if you're going to enroll in a medical plan. But for adults, it's optional. You can opt out of it if you want.
So because he's saying that, and because we talked about the Medicaid side, if I'm not in Medicaid and I'm choosing a plan through Nevada Health Link, I have to enroll in medical to choose dental and vision. I cannot just come in and choose dental and vision. I have to purchase a medical plan. Okay, so there's a lot of Medicare and Medicaid people. Medicaid people can do this, but Medicare people cannot get in and just choose dental and vision. You already have Medicare. Is that correct? Okay. So that's another big point that people ask for all the time. Other than that, I think John and I can open it up for questions that you guys have.
What about our children that are over 19 and under 26?
So that's your personal decision. And
include that. Well, a lot of these things we don't currently have in our insurance plan. It sounds like it'd be for our benefit to review the plans and add a bunch of new stuff.
that's absolutely true, and that's why it's consumer driven, and I think the individual mandate is important, that we all have to take responsibility. So it's a matter individually whether or not it works out best for you to keep your children on the plan if you need to age 26. And remember that dependent to age 26, they don't have to be your tax dependents. They don't have to be living with you. They can even be married. But if they're your if they're 26 or under and you're dependent, you can add them to your plan, whether that's through work or outside. So you have to decide for yourself individually, like I'm deciding for myself, what am I going to do with my son? I don't know if
Not a very secure password.
I don't know
I was going to tell
if
you.
Dr. Joe wants to moderate questions.
Yeah.
Tracy, did you explain that in your family you can have different plans for each person?
Yeah, and John, I think I'd like you to confirm this. So if I'm that family of 4, if I want to shop for a different plan and a different carrier for each of the members of my family, I can do that, right?
Yes, you can either choose to shop as a family or as individuals. The other thing that happens is, remember we talked about that max out-of-pocket, right? $6,350. It might be even lower for if you choose a higher plan. But let's just say you choose 2 bronze plans with a $6,350 out-of-pocket maximum individually, right? And one of you gets sick and racks up bills greater than $6,350. Your cost will be capped at $6,350. But if you enroll as a family, your cost will be capped at $12,700. Something to keep in mind. Now, so that's good as 2 people. And the rate is exactly the same shopping both as a family or individual. The rate is the same. All right? But when you start adding children onto that, right, you're capped at twice the individual amount. So let's say you're a family of 4. If you shop individually and each of you get sick, you could end up with pretty high out-of-pocket costs if they're all capped at $6,350 times 4. Right, $24,000, whatever that is, right? So keep that in mind on how you shop. Again, most families typically only 1 or 2 people get sick in the family. So an example, when I was with the I was with the Public Employee Benefits Program. I'm the Chief Financial Officer. I should know how to game the system as best I possibly could because I know how the claims are paid. My wife also worked for the state, so we're both covered under state insurance. Because we're both covered under state insurance, we could not be on the same plan together. That's just a rule for the state. Typically, you're on as a family. So we had separate plans. I had a daughter. She was on my wife's plan. But I knew my wife was going to get a cesarean for my son that was going to be born. And that was going to cost a lot of money. The out-of-pocket maximum was about let's say $4,000. No, $6,000. Deductibles, whatever it was. I said, I'm going to move my daughter under mine and put my son, who should be relatively healthy, under mine, and so that my wife's expenses for her hospital stay with the C-section should be capped, right? Let's just call it $4,000, right? So I thought I was going to be pretty smart and cap it there. Little did I know that I was going to get a hernia repair, my son was going to end up in the hospital with pneumonia, and he was going to get tubes put in his ears, and so both my wife and I both maxed out our out-of-pocket maximum, separate plans, 1 individual, 1 family, so we had to pay 3 times the individual out-of-pocket maximum for that. Now, again, shouldn't happen here. It happened to me. Doesn't happen very often that everybody in the family gets sick all at once. But keep that in mind on how you play that game. 2 people, I recommend putting them in separate plans. More than 2 people, you probably want to keep them under 1 family plan. Sir?
I've had a couple experiences with outpatient surgery, and both of them, the devil has been in the details of how they define a routine office visit. Or there are all these little classifications, and each time I had to fight for the definition in my favor. And I'm just wondering, none of those details are going to go away with these plans. We still have to fight for every little tooth and nail.
It is still complicated.
Yes.
It is still complicated. In fact, it's going to get more complicated because they've got something called ICD-10s, right, that you guys are going to have to comply with, that are about 10,000 more codes than what they've got now, something like that. So here's something that you typically won't get in a normal orientation class. What you want to ask when you go to the hospital, you want to ask, what is the contracted network discounted rate? What is a network discounted rate for this service? Now, oftentimes it's very difficult to understand that.
And they don't know.
And they don't know. All right, they will figure it out, but it takes a while to get to that point, right? So, my hernia repair, December 2011, right before I started this job. So I go to Sierra Surgery Center. I think the surgeons that are right at the base of Carson Tahoe, and I say, hey, help me. And they say, oh yeah, we can do the surgery for you. It was Friday, we'll do it for you on Monday. Go up and register, right? So I go to Sierra Surgery Center. Is that right? So I must have been with the surgeons, Sierra surgeons. I went to the Sierra Surgery Center, the outpatient facility, and they said, no, you're not up here, you're up at the hospital. And I know the hospital is more expensive than the outpatient clinic. So I go up to the hospital, I say, how much is this going to cost? And of course, well, it depends, blah, blah, blah. I said, well, how much is a network discount rate? They said $16,000. I said, no. I said, hernia repair, how much is, I know that you're going to charge a lot, and it's going to be discounted. What is the contracted rate with my insurance company, right? Well, you're probably going to pay about $2,000. No, I know I'm going to pay, there's deductible and coinsurance, right? But the problem is that the way the hospitals will delay billing so that your surgeon and the anesthesiologist bill first and are covered under the deductible, right? You pay 100% till you reach the deductible, and then you pay coinsurance, right? So if you have a $2,000 hospital bill, you have a $2,000 deductible, if you pay the hospital first, you're going to pay $2,000, but if it's 20% coinsurance after you've already paid $2,000 deductible, you're only going to pay 20%, you're only pay $400, right? So the hospital says, oh, you only pay $400, right? Because we bill after the surgeon and the anesthesiologist. I don't care what I'm going to, I mean, I do care what I'm going to pay, but in the long run, it's going to be a portion of whatever you end up charging the insurance company, whatever the contracted rate is, right? So what is a network discounted rate? Turns out the network discounted rate for the surgeon, the average, the master charge rate, it could be a 1-inch incision, it could be a 3-inch incision. The average, okay, is $11,000 is what they told me. I said, all right. So then I went to Sierra Surgery Center. What is the master charge, the average discounted rate for my insurance? And they said, I think it was $6,300, and South Meadows said $6,100, and I said, all right, I'll pay $200 more to be 5 minutes away instead of 30 minutes away. Okay. Or me and my insurance will pay for that. Instead of the $11,000, now I could have said, well, you know, $11,000, the insurance company's going to pay most of that. Well, if it's 20% of that, right, co-insurance, 20% of $5,000, I still would have paid $1,200, right? That's a lot of money. Not to mention knowing that as a claimant, I am going to pay whatever the hospital charges in premiums next year. Okay? Whatever we rack up in bills is going to be paid by us in insurance next year. So I actually was trying to reduce the cost for my insurance company, the state's self-funded plan, and I did that by $4,000. It's $4,000 less that the 77,000 people had to pay the next year, right? So, you know, okay, insurance companies, they make money, they're, you know, cold-hearted, all that kind of stuff, but the more you can save them now, the less your rates will go up in the future. So think about that.
So let me just say it too in a simpler way when I worked for an insurance company. My suggestion as a consumer is to tell that facility that I don't know who's going to bill first, and meeting my deductible depends on who bills first and what that discounted rate is. So I can pay you some amount of money to go have my surgeries, but I need to wait for my explanation of benefits to figure out who billed first and who do I owe first. Because if John had paid the facility his $2,000 deductible and the surgeon and the anesthesiologist are billing first, he might have to pay his $2,000 to them because they billed first. If I'm the facility getting my money first, how quickly am I likely to bill? Right? And then on the back side of it, I'm still going to be responsible for the person that did bill first because the insurance company determines who did my deductible, who do I pay for my deductible to. I don't determine that, and the facility doesn't determine that. It's when the bill comes in, who pays, and where does my deductible come from. So if I'm having multiple office visits leading up to something expensive, I want to wait for my explanation of benefits. Does that make sense too?
Yeah.
Okay.
We have a question from the crowd. I see we'll do one. Some were submitted on paper. Why is Dr. Joe here? I'm going to leave that one alone. Is there any advantage to go to private insurance instead of like marketplace, the marketplace, or healthcare.gov? So the HealthLink, healthcare.gov, or like looks like you're asking about maybe an insurance broker. So is there any advantage between going to different groups?
Yeah, so healthcare.gov, let's start with there, all right? For Nevadans, healthcare.gov is the fastest experience out of any of the other states. Because you go to healthcare.gov, it says what state are you in, you say Nevada, and it clicks you to Nevada HealthLink. So healthcare.gov is easy for us.
Save that step.
Yeah, so just go to NevadaHealthLink.com. So that's a start. And I think we talked about this earlier on. NevadaHealthLink.com, you can look at what's available generally, and then you can go outside and go direct with an insurer. Other insurers. Now, if you're looking at the insurers that provide a Nevada HealthLink, they provide the same plans at the same rate outside of the market. I don't think that the insurers that are offered in Nevada HealthLink offer any cheaper rates outside of Nevada HealthLink. So if you're going to go either direct to the insurer or in Nevada HealthLink, based on the fact that you like St. Mary's, then you might as well go into Nevada HealthLink. But if you want to get a better option, a better idea of, let's say you like Hometown Health, or maybe Humana's offering up here, they're not offering a Nevada HealthLink, so you might go directly to them. Again, go to doi.nv.gov to look at all the rates in the entire market. And then the other part of that is how do I get help? You can go straight to NevadaHealthLink.com. If you're somebody who likes to do it yourself, I don't want to talk to anybody, I just want to look on the website, I can do it all myself, by all means go ahead. The navigators are well-trained, especially those that used to be brokers are well-trained. I would say that if you are a navigator and you used to be a broker or agent, you're probably in the best trained that you possibly can. Brokers have a lot of experience, and if you end up with a broker that has done a lot of continuing education and has been paying attention over the last couple of years, you're probably good to go. If you end up with a broker that has not really been paying a whole lot of attention, they're not necessarily as well trained as the navigators. All of the rules have changed significantly starting in January, and the navigators were trained specifically on those rules. The brokers who have been around for 10, 20 years, they were trained on the rules in the past, and they may have done some continuing education more recently, but not necessarily. Again, brokers are a great resource, but make sure they understand the Affordable Care Act. We actually had, and so again, we've had the gamut. Every broker that goes through Nevada HealthLink, that enrolls people in Nevada HealthLink, had a 4-hour training course to talk about the HealthLink itself and how you get somebody through the application process and what you need to know, but not necessarily on all the ins and outs of the Affordable Care Act. We had some people that could spout out the law back to us, and we had others that could barely spell ACA. So keep that in mind. You might want to quiz them a little bit first. But both are generally a really good resource, and they should not cost you anything.
And let me just add, so in your handout on page 5, at the bottom bullet, you have the 4 carriers, because we didn't talk about the 4 carriers that are in Nevada HealthLink. So they're Anthem, Nevada Health Plan, which is part of United Healthcare.
Health Plan of Nevada.
Health Plan of Nevada, sorry, which is part of United Healthcare. Nevada Health Co-op, which is a new co-op that goes statewide, based out of Las Vegas, so that's a great option as well. And St. Mary's Health Plan. So a lot of people don't realize there's only 4 carriers in the marketplace for all of 2014. They offer a number of good plans. That's why it's important to check your provider list. It's important to check your prescription list. And as John has said in many occasions, those lists are really good lists. There's a lot of good doctors. I haven't come across any times where the people I've enrolled or the sisters have enrolled where the doctors people needed weren't on those lists.
Your 4 providers, though, aren't all total statewide, right?
No, so you still have, like John is talking about, you still have carriers outside the exchange. So if you want to go to Hometown Health, they're not available on the exchange.
We're hoping for next year.
Yeah, and I'm kind of surprised they weren't, because they were at every board meeting and they were at every session meeting that I attended, and I attended a lot. So if you want Hometown Health, if you want Aetna, if you want some of the other carriers, you can find those outside the exchange. The exchange is the only place you're going to get the advanced premium tax credit. You're not going to get that outside the exchange.
So
the exchange offers you that billing, that one-shot billing as well. So, I mean, there's lots of advantages to going through Nevada HealthLink that you don't get outside the marketplace. But as a shopper, if I'm going to save, a couple $1,000s a year, and I can find a comparable plan out there that's going to save me money, and I'm over 400%.
Yeah, so that billing thing that you just talked about. So let's say that you're under, you're that family of 4, you're at $40,000 a year, let's say $30,000. Your kids are eligible for Nevada Checkup. You'll pay a bill for Nevada Checkup. It's a small, $7, $10, something like that per month. Not a lot. Then you and your wife both select qualified health plans. And then you also select a dental plan. So that's 4 different bills, right? We're going to actually send you one bill. You pay us, we redistribute it to where it needs to go.
It's the best thing since sliced bread. Seriously. I don't know how you guys would not want to take advantage of it. Sorry.
My question is, so I And so my question is, how do I contact someone who is bilingual?
Okay, so Great Basin Primary Care Association actually has 2 CACs. They're right on Winnie Lane, right off Winnie Lane.
Okay.
So look up Great Basin Primary Care Association. I'm sorry I didn't bring their directory list, but they have 2 CACs. One of them is bilingual. His name is John Childress. Do you know him? Yeah, see? So John is working there part-time, and he's actually doing outreach because he will go out to the rurals as well to do enrollment.
And then, I'm sorry, just
That's okay.
back off of that. So I had a client come in today, and she went to welfare to apply for food stamps, Medicaid, and stuff. And it used to be on one application, and now she came back with like a 40-page book.
It's 64 pages. It's 64 pages.
Oh my,
Doesn't that convince you that you want to do it online?
Yeah.
wow.
Don't you want to do it online?
I know, exactly, but.
So, all right, so yes, it used to be one application. That 64 pages is really that one 16-page application. It's just, there's a lot of white space in there for optical character recognition. It's the same questions, it's just it's just spread out a little bit.
But if you're Medicaid eligible, you have to mail in all 64 pages. If you tear out any of those pages, they'll make you ineligible.